Good morning, and thank you for keeping it Citizen Television Daybreak. It is on this 28th day of the month of January, a month where we create awareness. Actually, I usually like saying we elevate awareness because this is something we should be doing throughout the year around cervical cancer. And of course, I know there's a lot of misinformation. There's a lot that people need to understand with regards to how many people are diagnosed annually in our country and even globally. There are questions about the options that we have out there in terms of prevention, in terms of treatment, and where the world is going. And that is what we will be breaking down for you. In case you're part of the statistics, of course, we also have a very inspiring story of somebody who we call her a cervical cancer survivor because it's a fierce fight against cancer that she put up. And also we have a doctor with me in studio who will be helping us understand the very basics about this particular chronic illness and also the very complex issues about it. So I'm talking about, from my far right, this morning I'm hosting Josephine Waithera. Karibu sana. Yeah, Josephine, it's good to have you. She's a cervical cancer survivor. We'd like to hear more about your experience, your journey, and just what this whole journey has taught you and changed about you. Karibu sana.
Asante.
And we have with us Dr. Buruna Mwita. He's a gynecology oncologist. We are glad that you created time for us this morning, Daktari, also just to teach us what we don't know or to demystify the misinformation that we have about cervical cancer. Once again, karibuni sana.
Well, thank you for having us.
And we invite you to ask any question. We invite you also to weigh in on our conversation at Citizen TV Kenya at Safina_Cheng. The hashtag is Citizen Daybreak, and we'll share some of those as we continue. But very quickly, let me begin with you, Daktari. It's the Cervical Cancer Awareness Month in January. Every year, we sort of like look at this monster in a different perspective. Probably you can tell me what has been your key highlight for this, significant month in 2026.
Well, as you've correctly said, this is the Cervical Cancer Awareness Month. And the key highlight, especially this year, 2026, about 2 weeks ago, that is on the 15th of January, the Ministry of Health actually launched what we call the National Cervical Cancer Elimination Plan. This is a plan that actually marries into the WHO targets, where we aim to eliminate cervical cancer, which has actually happened in some European countries. Australia, they have done quite well, and currently they're reporting almost nil cervical cancer cases. That is obviously through vaccination, which is a preventive measure. So if you look at the elimination plan vis-a-vis the WHO targets, so we aim to vaccinate 90% of our girls aged 9 to 14 years. We also aim to screen women using a high-performance screening test, with what we call the HPV test, those aged between 35 and 45, at least to have 2 tests by that age, which is the primary screening test. Then we also aim to, we cannot forget there are those that are already affected, either with precancerous lesions, that is the changes that lead to cancer, and those who have cancer. So we aim to treat 90% of these women. So like for the National Cancer Elimination Plan, it's a 2026 to 2030. So I'm sure by the end of it, we'll be able to talk about cervical cancer as a disease of the past.
Oh, really?
That would be the main aim.
I like how optimistic, we have begun this conversation.
Yes.
Because we all aim to get there. But the reason we are sitting down this morning is because we want to understand exactly how to get there at a time when we will have eliminated cervical cancer. And I'd like you, first of all, before I even get to Josephine's story, paint a picture for us about, do I call it how bad we look in terms of the numbers, both globally and even locally? We want to eliminate this monster. But then again, how bad do we look, or how good do we look as we sit here this morning?
Okay. So, when I talk about cervical cancer, I'm usually very passionate about it. And I always equate it to a favorite Bible story, that of David and Goliath. In this instant, I take Goliath to be cervical cancer. You remember, he was this beastly of a man, quite intimidating. The Israelites feared him quite a lot. He represents what cervical cancer is to us in the modern day. We look at David, a young courageous man who took it upon himself to actually fight these monsters. So the modern day David to me is the healthcare worker, the media who disseminates the information, and the cancer survivors who actually talk about it so that other people see it is something that can be managed. We look at the sling and stone that David used. Remember, he was given the shield, the armor, but he said, no, I will use this. So the simple instruments that we can also use to fight the Goliath, modern day Goliath, include the vaccination, the screening, and the treatment options. Nothing really complex. So when we look at the statistics we have globally, we have 600,000 new cases of cervical cancer being diagnosed, and most of these are actually in sub-Saharan Africa, Asia, somewhere Central America. 80–90% of these cases are here. Very few of them are in the other regions. And in terms of deaths, we have 350,000 deaths. So that shows the magnitude, the seriousness of this condition. So when we go lower to, when we come back to our local statistics, the past years we have had 6,000 new cases.
That's on an annual basis.
On an annual basis, 6,000 new cases, isn't it? Then for the deaths, we are losing about 3,500. So if you break that down, we're actually losing 10 mothers per day.
Wow, now
when you take it, it gets that serious. So
serious.
Losing 10 mothers per day to a disease that we can actually prevent doesn't look good. And I think that is why the ministry is very serious on actually handling or tackling these monster that we have.
I'm looking at these numbers, and it's not looking good, both globally and even locally, in terms of even how many people we lose among the new cases that are reported. I'm sure that's something that we can weigh in as we continue having this conversation. But Josephine, for you, ukisikiza, these are just not numbers. It's a life that you have experienced.
Yeah.
So maybe tukuniambia kidogo about your story, and ni when at what point in your life did you have an encounter with cervical cancer, even knowledge about it, ama kushuku that something is off, niende hospitali? Like, run me through what happened.
Yeah. Okay. Nilianzia 2020 on December. Nikakuwa na shida ya bleeding, nikakuwa na shida, a lot of discharge ilikuwa inatoka. So sikuwa najua naweza kuwa na shida gani. So nilikuwa naenda hospitali, napewa dawa, but haikuwa inaacha. So on 2021, mwezi wa 3, ndio nikakuwa na shida ya bleeding sana. Ikakuwa mingi sana. So nikakuwa admitted pale Nakuru PGH, na nikakuwa admitted pale for 1 week. Nikiwa pale ndio nikaambiwa nifanyiwe test ya biopsy, because wali suspect naweza kuwa na cervical cancer, but haiko imejulikana kama inaweza kuwa cervical cancer. So waliniambia wana suspect inaweza kuwa ni cervical cancer. But the moment niliambiwa hivyo, I remember I cried the whole day. Wakati waliniambia wana suspect inaweza kuwa na cervical cancer. So niliona mwisho wangu umefika. Niliona giza the whole day, and I cried the whole day. Nikafanyiwa sasa, ndio nikafanyiwa hiyo biopsy, na nikaambiwa ningoje for 2 weeks. But later after kulia sana, nikafika tu mahali nikajipea tu nguvu. Nikasema si mimi wa kwanza kukuwa na cervical cancer, na watu huonjeka na wanapona. So the results zikatoka after 2 weeks, na ndio nikapatikana niko na cervical cancer. Nikaambiwa sasa nifanyiwe test nifanyiwe MRI ndio wajue ilikuwa imefika stage gani. So by that time nilikuwa tu na wasiwasi, juu unajua nilikuwa nasikianga wakisema ikifika stage 4 watu huwa hawaponi. Na unajua sometimes ukisikiza watu venye wanasema hata kama iko stage 1 watu wanasemanga cancer haiponi. So nilikuwa na that fear isipatikane ikiwa stage 4. Because ikipatikana ikiwa stage 4 singekuwa na hope. So ndio nikafanywa ikapatikana ikiwa stage 3B. So ndio nikaambiwa sasa nianzie nini matibabu. Nikaambiwa ikifika stage 3B siwezi fanywa surgery yoyote, but kama ingekuwa stage 2 wangeifanya surgery na nifanywe some radiation. So nikaambiwa itabidi nitumwe Kenyatta ndio sasa nianze kufanywa matibabu pale. Yeah.
Tutazungumzia hiyo treatment, but wacha nikurudishe nyuma kidogo. So umeambiwa wanashuku that inaweza kuwa ni cervical cancer, and then it hits you, ukakuwa na huzuni. So tell me a bit about what were your fears? Ni nini hiyo ulikuwa unafikiria, because that is where many cancer patients begin. Ni nini ulikuwa umejua about cancer before then, and why were you so so much affected by even the thought that it could be cancer?
Okay, by that time waliniambia wana suspect. I remember kuna brother ya my dad na alikuwa amegonjeka cancer, na ilijulikana tu, yani haikukaa sana. So na alikufa, na alienda through pain, alipitia a lot of pain sababu ilikuwa ni kwa mguu, na niliona venye alipitia hiyo uchungu. And then by that time kuna wakati cancer ilikuwa inaua watu sana. So nilikuwa na that fear sababu unajua sasa kulingana na venye watu walikuwa naongeanga, ukisikia mtu akona cancer watu hawaonangi hope. So ukiambiwa uko na cancer unajua that is a death sentence, hakuna kitu kingine, ni kifo tu. So that's why I had that fear, nilikuwa naogopanga. Juu hata wakati watu walikuwa wanafanywa screening, mimi sikuwahi enda. Hata nikisikia mali kunafanywa screening, nilikuwa napitanga the other way.
Mbona uko unaenda screening?
Sababu nilikuwa naogopa maybe niende nifanywe screening nipatikane niko na cancer. Na by that time hata sikuwa na any symptom of nini cancer, but I had that fear. Na that fear ndio unaonanga inafanyanga watu wakose kufanywa screening, sababu wanajua ukipatikana na cancer wewe mambo yako imeisha hivyo. So that's why nilikuwa na hiyo fear. So wakati waliniambia wana suspect naweza kuwa na cervical cancer, so mimi mwenyewe nilijijazia inaweza kuwa ni hiyo sababu ya sign na symptoms zenye nilikuwa nazo. So nikajijazia inaweza kuwa ni cervical cancer. So I cried the whole day. Nikiimagine sasa ikipatikana ni hiyo, na tulikuwa tumezika brother ya my dad kitu kama miezi 3 nini imepita. So I had that fear.
Ukafeel ni kama inaweza kukufanyikia.
So
this fear is confirmed. So you are told uko na cancer. Na unaambiwa ni stage 3B. So how is Josephine receiving this news? What happened?
Okay, hiyo time sasa ndio nikaambiwa iko stage 3B. I thank God. Na sometimes tunasemanga kufanywa counseling inakuanga mzuri sana. Hiyo time nikiwa pale hospitali nikapatana na mama mmoja alikuwa admitted pale, na bado alikuwa na cervical cancer, alikuwa ametibiwa but akakuwa na shida nini side effects za radiotherapy na vitu zingine. So akiwa pale wakati kwa kuongea tukaongea naye, akaniuliza shida yako ni nini? Sasa nikamwambia na suspectiwa anaweza kuwa na cervical cancer, na already nishafanywa nini hiyo test na nikapatikana niko nayo. So akanipea hope, akaniambia hata kama itapatikana ni cervical cancer usikuwe na wasiwasi, watu huwa wanapona. So nikaichukua very positive, ati watu huwa wanapona. So nikakuwa very positive, nikamwambia kwa hivyo hata mimi nitapona. Akaniambia utapona na watu wengi huwa wanapona, bora ukue positive at your mind. Na kitu ya pili ujikubali, hivyo ndio kuko. Na kitu ya tatu you just have faith. Na utibiwe, ufanye venye daktari anakwambia. Usisikize watu wengine na usisikize nje.
Alright. But then before ufike hapo ilikuwa imekuwa affect, ilikuwa imekupatia ile uoga, si ndio? Daktari, you've had share her journey, and I could pick a lot from just how the entire process went, from the fear of being tested. Huku Kenya watu wasema what you don't know will not kill you, like mimi sitaki kujua, wacha tu niishi nikufe kwa kitu yenye sijui ni nini. People don't want to go for test. There's also the symptoms. For her, she says it got worse in 2021 March. She had to go to the hospital. So maybe run us through what cervical cancer, what it is and how does it present? Yeah, tuanzie hapo.
So her story resonates with many other cervical cancer patients. So I think we all know that cervical cancer is actually caused by a virus known as HPV, human papilloma virus. And this is a virus that can be, that someone can get through various ways. Okay, so the commonest misconception outside there is that it's purely a sexually transmitted disease. And you know, if people go with this mentality, it is actually one of the reasons we are seeing very low uptake of the HPV vaccine, because, you know, parents are like, this is a sexually transmitted disease. If we give our children the vaccine, it means we are giving them the leeway to go have sex. No, that is not the message that we should be sending out there. HPV can actually even be acquired through skin-to-skin contact. It is a virus you can get by sharing towels, isn't it? You can get it from, basically from anywhere. Because if you look at the risk factors that we put forth for cervical cancer, always number one, you'll see having multiple sexual partners. So it revolves a lot around sex, isn't it? There's smoking, obvious, alcohol, lack of screening is also a risk factor. But the sexual bit is what we want to really demystify, that it's not the only way you can get. Because, you know, the moment we put it that way, we are condemning maybe the survivors to eternal ridicule that they are promiscuous or something like that. That is not the case.
A myth.
That is a myth. Yeah. So you can get these in any form. So the other thing Josephine has said is about the screening bit. She was scared of going for screening. Why are we going to look?
Are scared.
And many women will tell you that they are scared of going for this screening. Why am I going to look for something that I don't feel that I have? But again, I think it is how the message is passed, especially when you're talking about pap smear. You'll hear many people say that the pap smear is actually a test to check whether you have cancer. Far from that. That is not the real reason you're having the pap smear. The pap smear is actually there to check whether you have those very early changes that may lead to cervical cancer. Remember, when you have the very early changes, depending on which one you have, it may take you 5-15 years before you get the actual cancer. So it gives you a very long period. And that is why we encourage women to go for screening repeatedly.
So the pap smear is something you should do regularly, regardless of whether you're showing symptoms or not? Or
not, yes. So it is something you do regularly, usually every 3 years. But if you're HIV positive, that goes down to yearly. Because with HIV, again, immunity going down, your risk of getting cervical cancer is higher than the general population, isn't it? But again, the other reason women do not go for screening, especially the pap smear, is, you know, it's a very intimate examination. Yes, so many women fear exposing themselves for something that may not be there.
Yeah.
So, as she said, also counseling is very important. But again, we are moving away from pap smear being the primary test. So currently, the primary test is actually the HPV test. Remember, we said HPV is the causative, is the organism that leads to cervical cancer.
Just a question on the HPV.
Yes.
I don't know whether it's factual that you could have it in your system. Does it mean that as long as you have HPV within your system, you can have cervical cancer, or there are chances of it clearing out? There
are chances of clearing out. As we said, it's a very common organism in the body. And more than 90%, more than 95% of people are actually able to clear the virus. So sometimes I equate it to the common cold homa. You get it without treatment, it still goes away, isn't it? But there are those who now get complications, pneumonia and all that. Same thing to the HPV virus. So a majority of people are able to clear this virus
so what
from
happens
the system.
To the minority?
The minority.
What's the complexity?
So, what leads to cervical cancer is persistent infection with HIV, with the HPV virus, isn't it? And that is, we talked about the risk factors. If you're HIV positive, your immunity. If you're smoking, obviously, it may enhance the persistence of the virus in your system.
All right.
Yes.
I'll come back to you, Dr. But just before you are diagnosed, before upate your information that you have cervical cancer, what did you know about cervical cancer before? And had you ever even interacted with this term or even thought about, did you know about cancer? Uliniambia there was an uncle, but wewe personally, had you, interacted with that world?
Okay, me personally, mbeleni, sikuwa najua more about cancer. Because what I knew, nilikuwa tu najuanga cancer inakuanga na cancer huwa inaua watu. So that's what niligrow nikijua. So sikuwa najua zaidi ya hiyo. So that's why hata nikiambiwa kuna mahali wanafanywa screening, I never bothered. Because I knew cancer inakuanga na cancer huwa inaua watu. So sikuwa najua anything beyond.
So ilikupata kama haukuwa na information?
Yeah, sikuwa na information. Yeah.
Cancer, not even cervical cancer, it's cancer yoyote.
Yeah.
Like you didn't have information.
Yeah.
So tell me, ulipoambia uko na cancer, what changed around you? How did your family receive this news? Did it affect aje as a family and even you as an individual?
Yeah.
What changed about you around that time when you were still not well?
Yeah.
Before uanze matibabu?
Okay, the moment niliambiwa niko na cancer, iliwa affect sana. Sababu saa unajua ugonjwa kama huyu ikiingia kwa boma, kitu ya kwanza familia inajuanga, pesa imeisha hivyo. Sababu unajua ugonjwa inatumia pesa mingi. Na kitu ya pili, wanakaa na hofu. Sababu hawajui kama utapona ama utakufa. So wanakuanga wako tu 50-50. So iliwa affect sana, sababu sasa unajua hata sasa hawakuwa wanajua wataanzia wapi, watamalizia wapi. Na sasa kwa boma yetu tulikuwa tumezika already mtu mmoja juu ya cancer. So walikuwa chini sana. But I thank God, mimi mwenyewe, the moment venye niliambiwa pale na nikakuwa positive. So mimi ndio nilikuwa nawatia nguvu. Na nikawaambia, mimi kama mimi mwenyewe niko positive na niko sure nitapona. So sioni haja yenu kukua yani kukua mko down sana. Kenye tunafaa sasa ni kujua venye nitatibiwa na venye nitaanza matibabu. So ikafika mahali nao wakaanza sasa kukua positive. So wakaanza sasa kushughulika na venye nitatibiwa na waka accept hivyo ndio iko. Because myself nili accept hivyo na nika accept niko na cancer na nikajikubali na nikaambia mind zangu niko na cancer na hakuna kitu kingine naweza fanya. Hata nikikosa usingizi usiku the whole night nikiwaza niko na cancer nikukufa nitakufa. So wakafika mahali na wao wakajikubali. So tukaanza sasa kujua means of treatment. Yeah.
So your strength iliwasaidia na wao
sana. Yeah.
Wakuwa na strength. So ni nini ilibadilika maybe kiafya in your own life? What could you do? What couldn't you do? You know, before uanze matibabu ulikuwa...
Before nianze matibabu, mimi mwenyewe nilikuwa nimedhoofika sana. Juu unaona sasa nilikuwa na hizo shida za bleeding. So hata kukula ilikuwa ni shida. Sikuwa naweza kukula. Juu hata nilikuwa nimeruhusa hadi appetite. Inafanya hadi wewe mwenyewe unaruhusa appetite na ile sasa unaona unakaa na tension. So hata kukula sikuwa naweza kukula. Mwili yangu nilikuwa nimeanza kulose weight. So nilikuwa nimelose weight, nakumbuka within a month nilikuwa nimelose almost 5 kg within mwezi moja.
Within 1 month.
Yeah, within 1 month. Unaona sasa sikuwa naweza kukula. Mimi mwenyewe hata kama nilikuwa positive, but unaona bado uko na ile fear sababu hujui what next. So mimi mwenyewe nilikuwa nimedhoofika sana. Ilikuwa imeni affect sana sababu unapata hata kazi zingine huwezi fanya. Inabidi sasa unafanywa kazi because I had a lot of pain. Nilikuwa na uchungu sana, unajua sasa uchungu ilikuwa hapa chini na ingine ilikuwa hapa nyuma. Na hata kufanya kazi singeweza. So ilibidi nikaacha kufanya kazi kwenye nilikuwa nafanyanga. Ikabidi nikae nyumbani sababu anytime nitajipata nina bleed. Anytime una bleed. So hata huwezi enda mahali, huwezi attend hata kama ni church, huwezi enda anywhere, hata kwa duka huwezi enda. So nilikuwa na bakingi pale nyumbani tu, nimekaa hapo nikijiobserve venye niko, sababu anytime naweza gonjeka tena, ndio huo nimekimbisha hospitali juu ya shida za bleeding.
All right.
Yeah.
Doctor, maybe you can pick from that and also just tell us more symptoms and signs how cervical cancer presents. Many patients and survivors have spoken to say the journey began with a discharge that was a bit off, then ikaongezeka, some say ilianza kuwa na harufu kidogo, then that is what brought made them go to the hospital. So tell us a bit about some more signs and symptoms. There could be somebody watching anapitia hiyo na ajui.
Yes.
Yeah.
So listening to Josephine's story again, it's quite typical of what women go through. You remember when we started out, we went through some statistics. We are saying in Kenya, we lose 10 women to cervical cancer every day, isn't it? So those are just statistics. 10 women died. But you see how she's putting it. If you go down to the family level, the nuclear family level, you can hear the devastation, the mental anguish, the physical pain that they feel. Josephine is obviously a mother, isn't it? A wife to someone, a daughter to someone, a sister to someone. I'm sure she was working, contributing to the economy, but the moment you have this disease, she has to stay at home. You have had her fears, even the family's fear the moment you have a diagnosis of cancer, though not a death sentence, but you can imagine the resources that have to be put forth to actually treat this. Yes. So apart from the patient herself, the family also suffers quite a lot. So we should not treat this as a statistic only. And looking at the devastation and knowing very well that we have a solution. It is a disease that can be preventable. We should not get to where Josephine got. The other thing I picked from her, she said she started bleeding at some point, which was abnormal, but she went to health facilities, but she was just being given medication to control the bleeding. I think it's also a call to us as healthcare workers to be more vigilant, isn't it? Think about the possible causes. Obviously, if a woman comes to you, they're having abnormal bleeding, let us do a full workup to avoid, the more you delay, the disease progresses. It's not waiting for anyone.
But do we have the capacity, if you look at our current setup, even in the villages, I want to believe there are women in the village who are also at risk of cervical cancer. So
yes.
Do we have the capacity even in those areas? We have
the capacity to actually screen all the way down to the community hospitals as we have it.
Do we have
we may not have the pap smears, the HPV test, but we have what we call via villi. It's just some liquid we use to paint the cervix. It will show some changes, isn't it? So once the changes are there, we have trained health care workers to pick them out. They can refer these patients. So all the way at the community level, we can do screening.
All right.
Yes.
So quickly run me through the signs and symptoms. So bleeding, discharge.
So usually, in the very early stages, there are no symptoms completely. And that is why we are insisting on screening. Screen. That should be the message everyone should get once we are out of here. So the first one is vaccination of our young girls, and the other one is screening. That should be the message everyone should get once we are out of here. By the time you're getting symptoms, you see, she said very well that she started having this abnormal bleeding. She was given medication, I think 6 months later, when the healthcare worker examined her, she actually found she already had the cancer. So by the time you're getting the symptoms of bleeding, and this bleeding characteristically is what we call postcoital, that is bleeding after sex. So that's one of the commonest symptoms that you get. She has mentioned the pains can be low abdominal, it could be at the back. There's obviously wasting, because these are people who are not feeding well, isn't it? And once the disease spreads, it could go to the surrounding organs, the bladder, the fecal passage and all that. So you get symptoms depending also where the disease has spread to. And obviously you mentioned a foul smell. Usually they have a very characteristic foul smell, patients with the cervical cancer. And it's actually one of the things that makes them seclude themselves from the rest of the people. Yes.
All right. Let me take you to the diagnosis, how it's done.
Yes.
And the staging, because anasema alikuwa na stage 3B.
Yes, yes.
So tufike hapo. Tell us, so you have these symptoms. So you've gone, and how does the medical practitioner now, zeroes in to really get that diagnosis, whether it's cervical cancer or not? How is the diagnosis done and the staging? And try and be as simple as possible. Ndio watu wangu wasifikirie tuko medical school, school of medicine.
No, it's very simple. I think Josephine actually explained what happened when she went to this healthcare worker. They examined her. So basically you're looking at the cervix, and for her there was an obvious swelling. There is obviously the way a normal cervix looks like. So you can tell if it is abnormal. So for us to make a diagnosis, you have to pick a small piece. We call it a tissue biopsy, a small piece that is now interpreted by a doctor called a pathologist, who will now give us the real diagnosis. Remember, not all swellings in the cervix have to be cervical cancer. You can get other things, including TB of the cervix. It would look almost the same as cervical. So that is why we have to take the biopsy for evaluation. So that is how the diagnosis is usually made. Now, once you have made a diagnosis, as she rightly said, we go to the staging. The staging phase. Remember, when you're still picking the biopsy in the office or theater, you can do what we call clinical staging. But I think she went further and did what we call radiological staging, where an MRI was done. So this is able to pick how the disease has spread. So I think that is where she got her stage 3B diagnosis.
So run us through the stages and talk to us about the severity of the stages. Because
so usually
that fear. Hata alisema ati the earlier the better.
The earlier the better. So usually when we are staging, generally stage 1 and 2 is early stage. Early stage disease. Stage 3 and 4 is what you'd call late stage disease. So that also impacts how we treat the patients, because for stage 1 and 2, we can still do radiotherapy and chemotherapy, but on top of that, we can actually do surgery. So if it is very early stage, you can just do surgery, remove the disease, and you may not need more treatment. But the moment you get to stage 3 and 4, we may not be able to do, we do not do surgeries. So we opt for chemotherapy and radiotherapy, either in combination or singly.
All right.
Yes.
Josephine, so let's get there. So ulipoambia uko na cancer, already umepitia the stress, and it took a toll on you and your family, or effect. But then ukaji encourage, ukasema, nijikubali tu. So you're here. So what options were you given in terms of which direction to go? Matibabu gani ndio, like options gani ulipatiwa, and then how did you settle on what processes you were taken through?
Okay, after kupatikana ikiwa stage 3B, so nilipatikana pale na PGH. So wakaniambia siwezi tibiwa pale. Sasa ishapita stage 2. So wakaniambia sasa itabidi niende Kenyatta. Ndio nikatumwa Kenyatta, nikakuja nikabukiwa. So nikaambiwa kuna matibabu sasa waliniambia nitaenda. So nikaambiwa nitaenda radiotherapy 25 session, na niende chemotherapy 5 session, na nirudi nimalizie na brachytherapy. Sasa niende brachytherapy 3. So ndio nikakuwa booked pale Kenyatta, and I thank God sikukaa, sababu sometimes unabukiwa unaambiwa ngoje for 2 weeks ndio uanze matibabu. But for me nilianza immediately, sababu nikiwa pale Kenyatta nikashikwa tena na hizo shida za bleeding. na nikikuja pale nilikuwa already nishaongezewa damu. Unajua damu yangu ilikuwa chini sana. Na ukianza matibabu walikuwa ufai kuanza damu ikiwa 11 kurudi chini. So lazima damu ingekuwa juu. So nikiwa pale Kenyatta nikaanza bleeding tena na bleed yani mingi sana. So nikashughulikiwa, naambiaga Mungu asante sana sababu ili happen na ningerudi nyumbani nikae for 2 weeks. So nikaanza immediately. Nikaenda ndio sasa nikabukiwa, nikafanywa yenye wanafanyanga sijui inaitangwa mapping ama sijui nini, daktari atatuambia. Ndio sasa nianze kuchoma na ile miale ya stima. Immediately nikaanza radiotherapy na nikabukiwa kesho yake nianze na chemotherapy. So nikakuwa nikienda Monday to Friday pale Kenyatta Hospital.
So unatoka Nakuru ama ulikuwa na?
No, sasa challenge nilikuwa napitia na those challenges ndio cancer patient huwa wanapitia. So sikuwa na mahali kwa kukaa. Na hata ningekaa labda niko na relatives but wako mbali, wengine wako Githurai. Na unajua sasa singeweza kutembea na mat, singeenda na matatu sababu unajua I had a lot of pain na hiyo bleeding, so singeweza kutembea na matatu, gari za barabara public. So ilibidi nikapelekwa, kuna nyumba wanakuanga wanazo pale Kenyatta Market, wanazitanga sijui ni cancer home. Mtu anachukua tu nyumba ana rent, anaweka wagonjwa wa cancer pale. So hapo ndio nilipelekwa, tulikuwa tunalipa 700 per day. Ili nikae pale, ili nikitoka hapo sasa nilikuwa naenda na Uber hadi Kenyatta. So nilikaa pale mwezi moja na nusu, naenda Kenyatta asubuhi, nikishamaliziwa kutibiwa narudi pale.
That is 700 per day.
Per day,
nyumba peke yake.
Nyumba peke yake.
Ongelelea chakula, even the transportation.
700 per day. So nikakaa pale mwezi moja na nusu, nikienda Kenyatta asubuhi na saizo bado ninatumia Uber. Kwenda Kenyatta, ninatibiwa, ninarudi. So nikakaa pale mwezi moja na nusu. Nikienda hizo treatment, radiotherapy, chemotherapy, but sasa brachytherapy sikuenda pale.
So ulimaliza the entire treatment?
Nilimaliza the entire treatment. Nilienda hizo radiotherapy 25 na nikaenda chemotherapy 5. Though it was challenging sababu hata matibabu zenyewe bado zinafanya unakuwa very weak.
Unaisema asif ni kuenda tu unafanyiwa na It takes a toll on you. Talk to me about that kidogo, like it affect aje.
Radiotherapy,
very strong treatment.
Ilini affect sana. Sababu the moment nilianza kuchomwa na zile miale za stima, nilianza kudevelop vidonda. Nilianza kutoka vidonda huku juu. Sasa unajua hiyo stima sasa inakuchoma kuanzia hapa hadi hapa. So kuna vidonda zilianza kutoka na hizo vidonda zilikuwa uchungu sana. Na bado vile nilikuwa natoka hizo vidonda, kuna uchungu bado inapanda huku kwa tumbo. So unasikia tumbo yote imejaa pain. Na chemotherapy yenyewe nao ilikuwa inafanya unashindwa hadi kukula, una lose appetite sababu unajua sasa zile dawa ni strong. So unapata hauwezi kukula. Sasa mwili yako ishaanza kudhoofika, so cancer inakufinya na bado treatment zinakufinya. Kwanza treatment ndio huwa na pesa inakufinya. So unaona ni mtu mmoja unapitia ile yote. Pesa inakufinya, treatment zinakufinya. But I thank God, nilirespond very vizuri sana. Though nilifinyika for 2 weeks. Nilikuwa very weak. Juu hizo radiotherapy na nini nilikuwa very weak na nilikuwa very down.
So treatment process yako ilichukua kama mwezi moja, mwezi mbili hivi?
Mwezi moja na nusu, 25 days.
25 days. Okay. Daktari, I know you have a lot to add in terms of the treatment options that are out there and what usually helps you as professionals to decide hii ni surgery, itakuwa sawa, hii ni, like what do you use to gauge what the patient ought to go through?
Okay. So you know when we are talking about treatment of cervical cancer, we start from the pre-cancerous lesions, the ones that pap smears picks. So these are lesions that are not cancerous lesions. So treatment can start from there. So there are lesions that we get which guides us on how to manage. So you can actually just remove a portion of the cervix as adequate treatment for that. And these are office procedures. You walk in, it's done, you go home, isn't it? But now the moment you have invasive disease now, the full-blown cancer, we had mentioned about the staging. So that is what guides us on what kind of treatment to give. The other thing that would guide us is the patient condition. Very elderly people, sick looking. So if it was a younger person, they would have qualified maybe for surgery, but looking at this one because of age, her nutritional status, you're like, this one may not go for surgery. But Generally for stage 1 and 2, early stage 2, you can actually do surgery, isn't it? So, you know, once we remove whatever we have removed, the disease process, and the pathologist has given us a write-up on what they saw, that again guides us on whether the surgery was adequate treatment or they may need more treatment in terms of chemotherapy or radiotherapy. That is for early disease. But for late disease, stage 3 and 4, we do chemotherapy and radiotherapy. Yes, mostly in combination.
What are some of the side effects and impacts of these treatments? What's the harshest that you've seen patients go through?
So as she has correctly said, we have short-term and long-term effects. So the immediate effect, as she mentioned, you can get what you call the skin burns. Remember, there are organs around, isn't it? So we have the bladder, we have the rectum. They can also be affected. Later, you can get bleeding from the same bladder. You can get from the rectum. Remember, also radiotherapy as a long-term side effect can also bring about other cancers, isn't it? Yeah. So there are quite a number of side effects, though not everyone gets this, and the side effects are things that can be managed, isn't it? Yeah.
There's usually the nexus between fertility and the treatment for cancer.
Yes.
And when we're starting this show, I remember we even mentioned the age of the cases we are receiving these days. Kitambo, we used to assume that it's older women who get most of these cervical cancer cases, but we've seen trends changing. Younger women are increasingly being diagnosed.
Yes.
Women who've not even started their families yet, hata hawajaanza familia. So concerns are that kuna some treatments that may impact the fertility. Talk to us about that complexity and how you're dealing with it.
Oh yes. I think I mentioned to you, like, the youngest cervical cancer patient I have managed was actually 23 years old, and she was also stage 3, like Josephine here. Unfortunately,
at 27.
At 23 years.
23
years, yes. So unfortunately, with the treatment modalities, we forget about fertility at that point, isn't it? But you know, when we're talking about fertility, that is why we keep insisting, let us vaccinate our children. Let us go for the pap smears. It is also one of the ways that we will be able to retain fertility by either making a diagnosis early. Remember, for cervical cancer, very early stage 1, you can actually preserve fertility by just removing the area that is diseased, isn't it? And let the mother proceed and conceive. But later stages, it becomes quite complex, because even having radiotherapy itself can destroy the ovaries. Yes, isn't it? Yes.
All right. So Josephine, I don't know kama we ulikuwa ushamaliza your journey of motherhood before the treatment ama bado?
Yeah, nilikuwa nimemaliza, though unajua sasa I had some hope ningeza wengine.
Oh, ulikuwa umeweka koma. Nilikuwa na acting last born.
Sikuwa nimeweka koma kabisa. Ndio unajua nilikuwa na watoto 3. So but sasa juu nilipata hivyo.
Si ndio nasema uliweka koma, si full stop.
Niliweka koma.
But this is what happened. So you were treated, were you cleared, ukapewa the clean bill of health, ukaambiwa cancer, sasa you are cancer free, ama where are you at in that journey?
Okay, ni safari, sababu sasa venye nilimaliza hizo radiotherapy, so ndio nikarudi nikaambiwa nifanyiwe brachytherapy. Brachytherapy nilienda Eldoret. So nikafanyiwa brachytherapy 2. Na brachytherapy, I think, ndio the most painful treatment ya cancer. Nilipitia uchungu sijawahi pata, hata wakati wa kujifungua mtoto sijawahi sikia pain yenye nilipitia that time. So nikafanyiwa that brachytherapy 2, na ilikuwa na lot of side effect. Hata sasa I think hata kushinda sasa radiotherapy, sababu within 2 weeks hata siku hata naweza kutembea juu uchungu sana, hadi huko kwa mapaja ilikuwa imefura, yani inakaa reddish. Na saa hizo bado vidonda hazikuwa zimeisha zenye nilikuwa nimefanywa wakati wa radiotherapy. So bado nilikuwa na zile vidonda na sasa bado niongezewe sasa nifanyiwe brachytherapy. So after that kufanyiwa brachytherapy, so nikaambiwa sasa nitakuwa nafanyiwa follow up, clinic check up. So nilikuwa naenda after 3 months. Nikamaliza sasa nikakaa for 1 month ndio nikarudi Nakuru sasa. Ndio wanifanyie follow up na waone venye niko. Nikarudi Nakuru wakaniangalia and I thank God nilirespond vizuri sana. Though by that time nilikuwa na uchungu but treatment yani Mungu alinisaidia nikarespond vizuri sana. So after kurudi clinic after 1 month wakaona niko sawa. So nikaambiwa tena nirudi after miezi 3. Na sasa hizo bado niko tu na hizo side effect, bado siwezi kukula. Zile side effect bado za chemotherapy hazikuwa zimeisha. By that time nywele yangu haikutoka. Na unajua kitambo nilikuwa nafikirianga wagonjwa wa kansa unajua walikuwa naambiwa hawana nywele. So mimi nilishikujua kansa ndio inafanyaga nywele inangooka. So nilikuwa na hofu sana, nilikuwa na imagine sasa kanywele kangu kakingooka nitabaki aje na niko
crown as a woman.
Na niko na kipara sasa unaona. So I was worried. But I thank God yangu haikungooka but ilikuwa nyepesi, ilikuwa inakaa ya wodia somehow. So nilikuwa napaka tu mafuta na kuwa sawa. So nikafanywa clinic check up nikaenda after 3 months. Kurudi tena after 3 months wakaniambia niko sawa. So nilikuwa tu na side effect kidogo hivyo, unapata sometime choo yako inakuwa ngumu. So unapewa zile dawa za kufanya choo yako inalainika. So nikakuwa tu nikifanya hizo hivyo, nikafika mahali sasa wakaniambia nitakuwa nakuja after 6 months. Nikaenda, I thank God Mungu tu alikuwa pamoja nami. After 6 months sasa nikaambiwa nitakuwa nikirudi sasa nikarudi after 9 months. Hivyo the same wakaniangalia kuna sasa nikapigwa picha MRI. So venye nilipigwa picha ikaonekana iko sawa, hakuna cells za cancer, hakuna tumor inaonekana. So unaona nikaonekana sasa niko sawa, ninaanza kuimprove. So nikaambiwa utakuja after mwaka moja, after 1 year, after 1 year.
So utakuwa sasa unarudi for?
Yeah.
It has to be monitored like that, daktari, right?
Yes. So what the schedule she is having the visits, that is actually quite right. So and you know the visits will be there for her, I believe, yearly until, so it is lifelong follow-up. I hope you know that.
Yeah.
Yes. So that is quite right.
Yeah, it's safer just to keep track of what is going on.
To keep track. Yeah.
All right. Unfortunately, we've run out of time. I'd like to give you 1 minute each. It's very inspiring, Josephine, to inspire sana. Maybe let me start with you. Mtu maybe anakuwatch. Ako na cancer, bado ako vibaya, hajafika kwa ile level ya ku even face the treatment journey. Just encourage someone, na pia wale wenye hawajakuwa part of the statistics. What can you tell them tukimalizia?
Okay. Kile naweza ambia mtu yeyote mwenye maybe labda tuseme mwenye amekuwa diagnosed na anaona ni kama amefika mwisho, kitu ya kwanza nimwambie na nimpe hope. Ya kwanza nimwambie cancer is not a death sentence. Na unajua watu wengi wanasemanga cancer huwa inaua, nimpatie hope, nimwambie cancer is not a death sentence. But haitakuwa a death sentence ukikosa kujikubali. So the first thing ni kujikubali, hivyo ndio iko, uko na cancer and you accept it na ujikubali. Then the second thing, akue positive. Atia kwamba hata kama watu unajua sometimes people wanakuanga negative. Na utaambiwa a lot of stories, utaambiwa sijui cancer, sijui saa zingine hata tulikuwa tunaambiwa ni uchawi. Saa zingine tunaambiwa sijui ni myth, sijui nini inakuanga, sijui ni heritage, sijui na genetic, kitu kama hiyo. So nimwambia kwamba cancer si uchawi. Na cancer si ati ni kitu yenye inherit. Akishakuwa positive in his or her mind, akubali hivyo ndio kuko, na akubali kutibiwa. Juu wengine wanakataanga kutibiwa. Sometimes unapata mtu ako na kansa ya matiti, anasema yeye haezi katwa matiti. Hivyo tu venye yako, hivyo ndio aliumbwa na atakufa hivyo. So hiyo ndio unapataka inafinya wagonjwa wa kansa. So mtu ajikubali venye yako, akue positive, akubali aende atibiwe. Na hiyo sio mwisho yake. Sababu tunasema ya kwamba cancer is not a death sentence. Bado there is still hope. Watu huwa wanapona as long as you accept yourself na ukue positive na avoid negativity in your mind. Uconcentrate na vitu positive ya kwamba utapona. Sababu unajua hata kama wewe ni mgonjwa wa malaria, huwa tunapona kuanzia na hapa. Ukijikubali ati utapona, hata ukipewa, hata kama utapewa dawa za malaria, hata ukipewa Panadol unapona.
Thank you so much, Josephine. Daktari, your final thoughts?
Okay. So for me, it's a call to the parents. You know, the best gift when you're talking about cervical cancer, the best gift you can give your daughter is a cervical cancer-free future. How do you do that? Take them for vaccination. It is only one shot. One shot of the vaccine is adequate, and these are available for free, isn't it? Completely free in most health facility. Then obviously to the media, I mean, keep informing the masses about cervical cancer. Tell them it is preventable. Tell them to go for screening. So because if we catch the disease early, if we have skipped the step of vaccination, we can always catch this disease at the screening phase early enough, where treatment is actually curative as opposed to palliative. There is a young man I saw hugging a tree. So his mission was to create awareness. And I think he created a mini awareness campaign because many people are talking about him. So I was saying, if it takes us to hug the trees, let us hug them.
Yeah.
Yes, we will make Professor Wangari Maathai very, very happy. Very happy. If that is the only way the message will get out there, let us hug those trees.
Thank you so much, Dr. Buruna Mwita, for creating time for us. He's a gynecology oncologist, just sharing with us what we need to know about cervical cancer. And Josephine Waithera, thank you for inspiring us with your story and showing us that cancer is not a death sentence. Asante sana, both of you, for creating time, and thank you for watching. Now you know, and of course they say that it is something that can be prevented. It doesn't have to kill anyone, and all of us have a role to play, including taking the responsibility of going to get tested. Even if